Hey everyone, it is Dr. Heather, your virtual sports chiropractor, and I want to actually talk to you guys about something that is going to be more relatable to anyone who has been pregnant or is currently pregnant and is wondering, will I experience a diastasis recti? And all of my men are probably going, what the hell is that? I have no idea, but she said it's for women. We're going to leave it at that. Okay, so if you are one of my many pregnant women out there and you're still kind of exercising, you're still running, and you're doing all those things to keep your body healthy, just remember one thing. Your body may be slightly more prone to a diastasis recti. And you might be going, okay, Heather, I've heard that term before, but I'm not really sure what it is. And I was told I could still keep exercising. Well, you're not wrong, but we want to make sure that you don't do any damage to the abdominal wall. So this way, after you give birth, everything does kind of come back together nicely and you're not left with that ugly separation that you hear a lot of women talk about that have had that happen after giving birth. So what I want to do with you guys is I want to talk about it a little bit further. So this way you have a better understanding of what a diastasis recti is. So this way you know what to do. Now, recently I wound up having about 4 of my in-person clients all get pregnant pretty much around the same time. And we did wind up going ahead and doing their entire workout program pretty much right up to delivery. But again, we modified things depending on the trimester that they were in. Now, what is a diastasis recti? Okay. So if you are familiar with the six-pack abs, you know that is essentially, where we look to see our abdominal wall. And sometimes you'll see a little bit of a caved in area as you see those six-pack, muscles developing. Well, this is known as your rectus abdominis muscle. It is a large abdomen muscle, which pretty much, kind of goes over the stomach area and goes all the way down to essentially the pubic bone. Now, this is something that we do see happen when, women are pregnant and the belly starts growing a little bit further, but we also do see this kind of condition set in a little bit more post-pregnancy, because then all of a sudden, that large belly has to go ahead and start to shrink, its way down. And that's because, everything was super stretched and now it's essentially like a shock to the system. So this is something that we want to just make sure we have a better understanding of what happens. So, obviously as the baby is growing, we have an excessive inner abdominal pressure that's like starting to, create this abdomen wall to really kind of expand, stretch out a little bit more. Now, this is all normal. This isn't anything abnormal whatsoever. But what happens is, as everything is really starting to stretch, and as you're aware, during pregnancy, not only is your estrogen level kind of, up there, but you also get relaxin into your system as well. And relaxin is exactly what it states. It's going to start stretching everything and moving everything a little bit further. That's why our hips and our pelvis, everything starts opening a lot more to make room for that belly. That's why sometimes we see an increased lordotic curvature to our low back. And it's why some of us, when we're pregnant, can wind up getting more low back pain, sciatica, noticing some hip discomfort, things like that, and this is where you're going to see that the abdominal wall starts to separate, okay, which again is expected, but that separation, what happens is after pregnancy, it stays and it doesn't actually come back. So that is really what's meant by the diastasis recti. The rectominus, so that rectus abdominis muscle starts to tear, starts to stretch, and then after baby comes, it does not allow itself to kind of go back. And that's where I think a lot of women are like, okay, well, what should I be doing? Well, just remember one thing, if you are working out during pregnancy, make sure you're adjusting your workouts according to your trimester and to what other things might be going on as well. So comes a point where you're going to stop doing crunches, you're going to stop doing, plank positions or side planks. If you are still weightlifting and training, just make sure you maybe lessen the weight a little bit, because increasing that inner abdominal pressure can actually make that diastasis rectus start during the pregnancy versus, kind of post-pregnancy. Now, how do we really treat it? Okay, well, This is where we look at, understanding core work. Okay. And when I say core strengthening work, I'm not talking about doing a bunch of crunches. I'm not talking about really doing planks. What I'm really talking about is understanding what is meant by the core. And if you don't really kind of understand that, I would actually tell you guys to check out my five core exercise video, because I actually start going into, really what is meant by the core, and how you really strengthen it, because you do want to start with those Kegel exercises, because that really starts to now strengthen the pelvic floor muscles. And you want to really start strengthening the spinal stabilizer muscles and the transverse abdominis muscle, which, essentially starts from the center of us, below the sternum, wraps around all the way to the lumbar spine. So you do want to go ahead and have a better understanding, of how you're going to work those muscles. Now, again, as always, after pregnancy, you don't want to start exercising right away. You might be saying, hey, I think I can go for that run. Just check with your physician, make sure you're okay. Because even one of my, very good clients, after she gave birth, her doctor had said, well, we do want you to work with a pelvic floor specialist as well, because after trying to push out a baby for 9 hours, certain things have dropped. Okay. So we're talking about your uterus and things like that. Muscles may have gotten so lax, or, they've just gone ahead and dropped inside that pelvic floor area, that it's important to actually seek out some professionals who really work with certain specific conditions. And you do want to go with the advisement of your OBGYN and make sure they really have cleared you for exercise, so you don't do any further damage to yourself, to the organs, to your abdomen wall. You want to just err on the side of caution there. Now, if you have further questions on really kind of what it is you can do, if you have been cleared for exercise and you're looking to kind of get started more with understanding core work, drop some comments down below. Happy to give you some better guidance as to where to begin, and some really great ways to just kind of start easing back into exercise. As always, if you found some value in this little video on diastasis recti, just so you have a better understanding of what it is and where to kind of start to begin, then give it a thumbs up. And if you haven't subscribed to the channel, go ahead and do so today. All right, everyone, I'll catch you in the next video.